So once again, thanks a lot for all the participants, and in particular, thanks to Shahid, thanks to Dr. Shu, and thanks to Blada, and also the other audience who joined us for this session. This session, we will talk about the role of lay counselor and affected community, sit and recruit, playing key role in supporting key person to TB assessing, TB test, diagnosis and treatment during COVID-19. So my name is Chamran. I'm currently working with Khmer HIV/AIDS Anti Alliance in Cambodia, and I am facilitating this session together with support from Shahid of Alliance for Public Health. We have 45 minutes for this session, and I hope we can exchange learning among each other on different experience of our own context of how the affected community can maintain their critical role in supporting their peer to access TB services, including testing, diagnosis, treatment, and follow-up during COVID-19 pandemic. In addition, I hope we also can adopt some of this learning to continue and advocate in maintaining the role in maintain their critical role in supporting their peer to access TB services, including testing, diagnosis, treatment, follow-up during COVID-19. In addition, we hope we also can adopt some of this learning to continue and advocate in maintaining the role of affected community in TB services and program. So reflection on this key topic, I would like to share some of our work being implemented in Cambodia, and now I would like to have some support from Brada to project this slide. Brada?
You are muted.
We have several technical questions, and we would like to ask you to mute all your phone unless call to speak. Please use the function Q&A that if you have questions, and our chair will be choosing the most relevant and will be calling on participants to speak out. Use chat box only for most pressing issue, not to be overpopulated. We encourage participants to avoid using chat function as this often creates confusion. Thank you and enjoy our session.
Would you mind sharing, Blada? Would you mind project the slide?
Yeah.
Then I can walk through this particular presentation for the audience, and then follow some speech. Okay. So again, like I said, this session is about. Can you move to the first slide, Blada?
Just a moment.
Yep. So, like I said, this topic will talk about lay counselor and affected community, sit and recruit, playing key role in supporting key person to TB accessing TB test, diagnosis and treatment during COVID-19. And this is the slide from Cambodia, and I love to share some of the role that lay counselor and they themselves who are TB affected community play a critical role during this challenging time. So next slide, Blada. Yep. So this is the content for this presentation. So I will talk through some of the background of Kana. Sorry. Yes, please. So background of Kana, and then I will talk of community engagement in TB response. I will talk about result to date and some challenge and solution that we use and we face and we use, and some of the lesson learned and key message. So next slide, please. So some of you may know, so Kana first started in 1996, and we just one of the project in during that time of the International HIV/AIDS Alliance, which currently known as Frontline AIDS. We registered as a local NGO in 2000, and over the past 20 years, we play a critical role as one of the local NGO for HIV, TB, sexual reproductive health, and other health response in Cambodia through using community mobilization approach. And since the start, Kana mandate was to work in supporting role through a strong network of community-based implementing partner connect to the community they serve. And we have some support currently from different donors, including USAID, the Global Fund to fight tuberculosis and malaria, both the country mechanism and also the regional mechanism grant. We have support from the Stop TB Partnership. We have support from the Friend 5% Initiative, and some support from Frontline AIDS as well as from UN Women. Next slide, please. So the community that we have engaged in TB response in Cambodia, this include we recruit and train those who are living with TB and or experience TB to support us in, back to next previous slide, please. Yep. Next slide. Yes. To identify and find the peer of those who evaluate TB in their local setting. We call this is part of the first screening, and we support this affected community. They support their peer for referral to do second screening, and in particular to identify who could be the presumptive TB cases, and then support them to access different diagnoses, including microscopy, or gen expert, and X-ray. And then they also play a critical part to support those who diagnose with TB for treatment as well as treatment adherent and psychosocial support. They also support for organizing peer support group as advocacy or community-based monitoring. So please move to next slide, Blada. So this is just some of the picture. You can see that the community meet their peer. They also recruit their community structure, which we call SEED. And they support those affected community to go for referral or meeting with health provider for doing TB testing, diagnosis, and treatment. Next slide. So you could see, in addition to that, they also join health provider to undertake the contact investigation in community for TB prevention and TB preventive therapy through traveling across the flood and pale road. You can see that they do. This is a picture of doing the scale, you know, for those who the close contact of TB, and they register those for treatment. Even though they have to travel a long way, you know, especially in this time in Cambodia, some area flooded by the a few days ago. So next slide, Blada. Can you go to next slide, Lada?
Sorry, it doesn't.
Yes. Yeah, that's slide. Yes. So in this slide, you could see, no, next slide. Yeah. These are some activity concerning to, no, next slide, please. Yes. They
Next.
conduct, oh, sorry.
This one?
No. Yeah, here, stop. Next slide, previous slide, sorry. Yes. So you could see these are some of the home visit that our lay counselor sit and recruit. They conduct home visit to support those on treatment. But during the COVID time, they also provide some support for psychosocial support. And in addition to that, they also advocate to ensure that TB can be mainstream into local development plan by meeting with local authority and try to educate them how the mainstreaming is important to make sure that those TB affected community, they part and they can access and benefit from development plan of the local authority. Next slide, please.
Sorry, today.
So this is this result. This is the result to date in concerning to the role of lay counselor. Actually, the project worked in 10 districts supported by USAID, but for the role of this lay counselor in 5 districts running from October 2019 to September 20, you could see that they support for screening over 8,000 population, and they support for testing over 4,000, and people diagnosed with BK plus TB is 118, and for all 4 is 409, and about 407 supported to enroll in treatment. So you see that this is really a critical time, but the lay counselor and they themselves affected by the disease, but they still continue to provide the hand and support to get to those who in need of TB services. Next slide, please. Next slide. Okay, so in the meantime, like I said, you know, Cambodia is not different from other countries. We also affected by COVID-19. It was hard hit, especially in our contact between March to June 2020, where community event for TB awareness screening, as well as running the outreach mobile digital solution where we can use Gen Expert and X-ray machine to community for TB screening, testing, and diagnosis. That close to community is not possible because of some travel restriction and also some restriction around crowd gathering. So the way that we do this lay counselor, they themselves, like I say, they themselves also affected community. They try to meet one-to-one with other TB presumptive client to collect the sputum, and then they bring the sputum together to health facility, and we organize the mobile screening team to go to that facility in a specific appointment for doing the testing and diagnosis. So this prevent the crowd gathering, but actually maintain the physical distancing, yet increasing the access of TB affected community to TB testing, diagnosis, and treatment services. Next slide. So these are some lessons learned and key message. Lay counselors sit and recruit the member of community where they live. They know each other. They know who are the right candidate to be evaluated for TB, and this including support for TB screening. And you can see the result of GIL. Community trust and the care, love, and passion they express and exchange with one another. Strengthen the connection and encourage door-to-door visit and psychosocial support, made our lay counselors sit and recruit during the challenging time of COVID-19, in which increasing the access of TB affected community to TB screening, TB testing, diagnosis, and treatment services are currently impossible. Snowball approach, actually, we see that it's workable. Where we use affected community to go door to door, and it worked well for HIV, but now it also worked for finding the TB missing case. TB affected people who are demanding TB services were not left behind and were not overlooked during the COVID-19 pandemic, with the strong involvement of lay counselors, sit and recruit. But you may know in many countries, including our case, a community-led system remain marginal to mainstream health, to the mainstream healthcare system, and this must change. And we watch many health systems struggling during the COVID-19 pandemic. Thus, we need to continue promoting and engaging with this community and to make sure the progress they have made on TB is not lost. So next slide. So this is some of the support, some of the donor and partner that support us to do this kind of work. So we have the national program, we have USAID, we have the Global Fund, we have the National Center for HIV/AIDS, Stop TB, the Global Fund, India HIV/AIDS Alliance, who support us a part of the regional grant for harm reduction. We have Frontline Aid, and we have Friend Initiative and UN Women. So next slide. Yeah, so this is my last slide, and once again, thanks a lot for joining the discussion. So this is some experience that we share from Cambodia. So if anyone have any question, please do so. But or in the meantime, maybe I also invite Zahid to share some of the case in Ukraine, of how community play a critical role to support this kind of work during this challenging situation, and then followed by Dr. Sunang from Myanmar, and then a Q&A session could be open for everyone. So Shahid, the floor is yours. Thank you.
Thank you very much, Chamrun, and welcome all the participants. So my name is Zahid Islam. I work in the Ukraine with the Alliance for Public Health. So, I mean, in Ukraine, we operate TB activities as well as TB, HIV, and hepatitis. So one of the key issues we have during actually the COVID pandemic and the lockdown, traditionally Alliance work in the TB 4 different areas. We work on active TB case finding among most risk population, TB contact tracing, and we provide also medical and psychosocial support to the TB patients. And also we work within, in partnership with the government, actually doing the advocacy, communication and mobilization activities, which is SCSM activities. If you are working with the Global Fund grant, most of actually us know about the SCSM. So there is a national SCSM strategy that we have developed. So we provide support to the national SCSM strategy as well. So And big part of it is actually in advocacy and also communication. So what happened during the COVID situation? Usually we have NGOs working together with us as a partner who provide supports to the vulnerable population, TB patients, and MDR and normal TB patients. So, but in this COVID period of time, actually CSOs have become even more important in order for patients to be linking with the health center and the patient. So here in Cambodia, they use the lay counselor, but in the Ukraine setting, we have the NGO social worker who actually played that similar role of lay counselor. So they have been actually the bridge between the patients and healthcare facilities. But as opposed to previous period and the COVID period, I think due to additional requirements added for patients to be on treatment. For example, if a patient would take, let's say, 3 days to put on treatment from diagnostics to the treatment, but during the COVID period of time, I think it has been expanded. You know, the treatment, diagnostic to treatment time has been expanded a little bit because in between all these things, the patient needed to also do for COVID testing. They need to, because they are coming to the clinics, so patient needed to be COVID tested. So that actually took a couple of days time for patient to be put on treatment. And DOT services were limited due to, trying to avoid patients not coming to the clinic, so avoiding risk of any infection of TB as well as COVID. And most patients were transferred. So since patients were not coming to the clinic, we had to actually transfer most of the patients on the VOT, so sort of, video transmission, video follow-up, so, but there are some patients who are actually still provided DOT because those patients had either no internet, they don't know how to use the phone, so those patients were still provided DOT by our social workers. So just to give you a kind of a feeling of in terms of patients enrollment or engagement. So in first half of 2019 to first half of 2020, there was actually 37% of patient enrollment reduced because of the COVID-19, and that has impacted how we actually provided services. And because public transportations were not working because of this strict quarantine situation, and patient could not come to the hospital. But even though we provided in that situation patient who needed to come to hospital, we provided transportation or transportation allowance to the patient, because each of the patients who are not before the treatment, when patient is on treatment, they do receive some kind of social packages from the program. So that is food, some money for transportations, internet, and things like that. So that allowed them to also come to the clinic when it was not possible to provide them with DOT. And we have just want to kind of give, it is just beside the TB, but also we run some of our TB patients also on opioid substitution treatment program. So on the OST, what we did actually, because traditionally for OST, you need to come to the clinic every day. So when the quarantine started, since everything was locked down, so we thought, we can give the patients actually take-home dosage for, like, let's say 10 days. So at least they don't need to come to clinic every day. So we allowed, together with the government, we allowed patients to take home dosage for 10 days of methadone, for example, or buprenorphine. That has actually increased huge adherence to the treatment. And especially when we had the integrated care centers where all the patient could get, TB patient didn't need to come except OST patients. So we were allowed to give OST patient 10 days dosage. I think that has had a positive impact of the COVID as for us in Ukraine. So as for challenges, I think quarantine has usually the way we connect to our patients, our clients, is on the street, because they're mostly homeless, vulnerable population, and hard to reach population. But due to quarantine, we were not able to reach them in time in the traditional way. So that's one of the reasons why we had the reduction of patients enrollment into the program. And but we did provide our lay care providers, social workers, with the protective gear like PPE, masks, and the disinfectants. All of those things were provided to all our NGOs, the social workers, civil society organization working with us. They were provided with those items. And also we allowed our NGOs, so civil societies, to procure some of the TB medicine if needed. For example, patients could not come to the clinic to get a treatment, right? Take his dosage or take his treatment courses, so that NGOs could actually provide them with additional dose treatment they could procure and give it to the patient, so that there is no interruption for the patient. So that was kind of allowed to give them. And of course, we do provide psychosocial support and continuous VOT to patients who had the capacity, and we provided them with, internet sort of allowances. For example, every month they receive like $5 or something like that for internet connections and things like this, so they could be connected regularly. And so that has actually overall, I think, even though it has not actually impacted so much of adherence, the patients who are on treatment, that they did not fall out of treatment, but it has impacted actually enrolling new patients and providing support. How to reach population is still very difficult to reach, because the social workers can go as far as they can go. But now with the VOTs, I think we are able to kind of reach to those people who were initially at the beginning of quarantine, we were not able to achieve. So I think there are some, especially looking at one aspects of HIV OST situation, where we had a little bit of positive situation where we were able to give out for longer term dosage of methadone. And now actually in the country, we have more than 80%. We have around 13,000 patients receive OST treatment in the country. And out of this 13,000, 80% of the patients take their drugs home. So that, that allows them to not to be coming to the clinic every day and risk of infections and all. So overall, I would say, I mean, there are some challenging situations. And again, the risk, as maybe in many other sessions we have shared, risk of fund reallocation from TB to COVID and, the emergency situation, what is happening. So that is, we still find is a kind of a risk that in the country we still need to continue to fight to be able to, spend the money which is needed to be spent in the TB area. So yeah, I think that's kind of for me. Thank you.
Thank you very much, Shahid, for sharing this very impressive reflection of the role of community in your case, and how the supply should be arranged so then the community not required to go too often to clinic. And yes, this kind of thing is also similar to our case in Cambodia, in addition to the role that played by lay counselor to find the case, support for treatment. Cambodia actually is not in a lockdown situation, but we do have some travel restriction during the certain period, especially like I said from March to July. So which not allow people to do crowded gathering, but the community who they themselves are affected by the disease, they support the pay in the community to do so. So I think this is the context. So that great that this kind of role, the role maintained in this challenging situation. I tried to find Dr. Su from Myanmar, but he's still not yet joined us as part of the discussion. But in the meantime, we do have, I think, a question, comment, and we do have about 15 comment and questions. So
let's take
let me see some of the question concerning to what measure did we adopt to protect the lay counselor from infection, both TB and COVID-19. In India, just common in India, we have ASHA worker who do the same. And how often are they also screened? How is your retention in patient identified with immunity linking to treatment? Let me read through first, and then we try, Shahid and I try to answer as much as we can. Do you support or empower the community member who deal with TB issue in community? In South Africa, hello, in South Africa, we advocate for better salary for community health worker, but have found that they are almost on periphery of the health system with power dynamic, making it difficult for them to ask for better remuneration. Training, infection, prevention, equipment, support. Is this similar to you? Sam for the interesting presentation, and then let's move. Sam for you, great presentation and work. Ali counselor, the same community health volunteer, great, thank you. Do you think this kind of community engagement can be sustainable, especially if you are providing stipend or any kind of payment? What is the role of the Cambodian government in supporting your organization to ensure sustainability of your organization? What proportion of the country are you covering now, and your next plan? Let me read through first all the question and comment and try to capture. What proportion of the country are you covering now, and your next plan is? Saying proficiency, but Bersi Baku, DRTB counselor and DRTB is why we're working for Maison in South Africa. My question, Jimran, is as the great counselor and for our community and living community that is affected or infected with now COVID pandemic. Is there a psychosocial support provided for? Okay, so in overall, I just would like to share and go with Shahid maybe share some response as well, because
sorry, we have 7 minutes of our session.
Really?
Okay, we still have 7 minutes. Okay.
Yeah.
So, and I would like to ensure this session is more interactive, you know, so Shahid and I try to play with this short time. So in Cambodia, the way that we have lay counselor, they are receiving a small stipend, and during COVID-19, they also receive equipment and material that protect them not to be transmitted by, infected by COVID-19, including masks. And also, but they themselves also providing prevention education to their community as well. They got stipend from the project, but you know, they are living in their community. So whenever the project finishes, but they're still there. The knowledge with them, and they still continue to be the resource person for their community. And the community from this project, they know who they can contact and what support they can receive. So this structure is there, and whenever the project finishes, this social connection still exists, and they continue to work together. So that's what we have right now. But in the meantime, I think your question concerning to how to sustain this kind of project, this is something very, very good question, and we need to work together. When we say a resilient, sustainable health system, what do we mean? And what community system should be playing part? I think this is something that we continue to work together alongside with the government. How the government...
Can I respond to that a little bit?
Yeah, please, Shahid.
Yeah. Because since we have less time, I think we just needed to maybe select a couple of questions that we can respond perhaps. So I mean, in terms of sustainability, what we are doing in Ukraine, actually, Ukraine is going through a healthcare reform. Under the healthcare reform, we have a new section of the ministry is created, National Health Services of Ukraine, under which they define different services for different group of the diseases. Like HIV has a package of services, the government actually subcontract to the NGOs. So the plan is for us to actually transition from the donors to the government subcontracting social work, if you like. So the TB, for example, HIV, we have already quite a lot of services are transferred to the government from the donors. So Global Fund at the moment, for example, do not support all the services for HIV patients, partially. So there is a basic package which government support from the government budget. And there are additional support that we see for the marginalized group, hard to reach population, that is funded by the Global Fund. So for TB, we're actually proposing the same. TB has not yet been finalized. So, but by over the next couple of years, that is the process that we are going to go. Whatever a basic package of TB services will be taken over by the government. And there will be some, key hard to reach population extra support will be provided by the donor agencies. So that's kind of, a way to do it. We will be doing it, yeah.
The other question is concerning to training. I think this is also very important. So it's not just a stipend to support the people or motivate people to work, but capacity building is important. So I think this is something that the government can take over. The government can continue to play that part. In this situation, we work alongside with the national program to offer the training for these people. But I think there is a people moving in, moving out. So the ongoing training, ongoing recruitment of this community to be part of the TB program, I think that have to be maintained. And we in the context of Cambodia, we are doing so. I have my colleague Swanri, who also managing the program, TB program. If Vanri can step in, just a few minutes, Vanri. We have very short time before I and Shahid close the session, because I got alert from the union that we have to close soon. Swanri, would you like to say concerning to how we can sustain the community to stay in the program? Swanri, please.
Okay, thank Bang Chomran for giving the opportunity. So I think currently community not just only working alone with the project, but they also connecting to the community and also the commune council as part of the local authority as well. So they are work day to day, and they are meeting every month to come up with some kind of a specific agenda for TB. And they are also part of the community development plan. So that's why they can integrate the issue of TB, and they also can bring the voice of the TB affected community to the platform, to the forum. So that's why the way that they are working. So we hope that for a longer run, the community gonna be part of, and everyone gonna be part of the TB, and also including the commitment of the commune as well, because they already come up with some kind of TB-free community. So the one who gonna be also part of the project. So everyone gonna be work for TB. Everyone gonna be a responder. Everyone gonna be part of this project. So I think that the way that they are ensuring that for the longer run, the community can be future sustained as well. So I think that also the commitment of the community people, because we use the former TB, the one who used to be the affected communities, TB affected community. So that's why they know they spend with their family, their former friends, their colleague, their neighbor. So they are very committed. So that's why, and they can confirm from the previous study that even the incentives are quite small, but they are happy to work with this one. So although the project ended, but they still be part of the peer support group, and they be part of the community. So that I think that at least be addressed. Thank you.
Okay, thank you, Vanri. I think like Vanri mentioned, these people, they themselves living with TB. They experience for many months, as a TB survival, and they know how hard it is, but they know how the treatment and finding those who living with the disease to get too early testing, diagnosis, and treatment is very important. So I think this become a very strong resource, and I think we as a civil society, we need to work alongside with the government how this kind of work should continue to be supported to the community. But in the meantime, the way that we do, like Vanri mentioned, we try to mainstream TB response into local development programs, so then they could be sustained, so the local government or local authority, they do have some resource, and TB can be treated as one of the chronic disease, part of the development program, and they can invest, they can contract these people that used to be supported by the project to work again for certain program or for this particular program as well. and using that local resource. For our case, Kana, so far we have not yet received any funding from the government, but for HIV/AIDS, the government already put some resource for treatment. So we strongly believe that when our economy is better, the government will be keen to support further for prevention part. The same for TB. The government also put a lot of resource for TB program, but for funding to civil societies not yet exist. But I strongly believe that if there is any success story, if the model that we work is really sustainable, is really important for development program, I do believe that we need, as civil society, we need to continue to advocate and work alongside with the government to have this kind of modality adopted for the development program, and we have to get a resource from domestic financing.
Yeah.
Lada, how many more?
I think we still have maybe a few minutes. Just want to
so Shahid, yeah,
kind of respond to one of the questions in terms of how do we, manage reprogramming our programs during the pandemic issues. So basically, most of the donors have allowed us to reprogram activities during the pandemic time. It's Global Fund, CDC, USAID. So they have actually allowed that possibilities. So, for example, we had the budget, and from there we could actually reprogram some of those budget to, provide support to the COVID situation. So extra services and things like that. So basically, what happens is that government has not been able to provide any immediate support because government does not have money, but the donor have stepped out. But again, the issue is of sustainability. If these issues continues, how do we do further? So I think for COVID situation, that is a very special case that we need to actually work with the government to see that the funding is available. And we are having a dialogue with the government to actually increase funding on that. But as we all know, COVID has shrunk everybody's funding situation in all of the countries. And so I think we will continue to actually work with the government to see if additional funding can be allocated for social workers and actually different services. But one thing on the training, we do train all of our social workers, and currently we are doing it through the BOT. So there's a good platform on, video training. So I think people are getting more and more qualified, if you like, So they are getting into it and they know how to do it. So it's becoming much more popular. So thank you. I think we do not have much time, but so if there are any more questions, maybe we will look at the question and we can respond if there are any burning questions that we have not been able to respond due to the time.
I think most of the questions are very similar. Comment and questions are very similar. Shahid is around sustainability, how we continue to advocate to ensure that this community role be part of the health system response. I think, yes, you're right. So this is something that we civil society have to work together and learning from COVID, challenging from the COVID-19. I think that we need to make the case that community role is really important, and they the one that can support whenever the struggling or any challenge that our healthcare system cannot do. They the one who close to community can support. So right now, the question by some audience, they mentioned whether lay counselor is part of the health system. No, right now, lay counselor, they themselves are TB affected community, and they supported by the project. But some of the lay counselor also work as a volunteer in the health system for certain areas, certain district, certain province in Cambodia. And I think from experience that we do work here in Cambodia for HIV, for TB, for other programs, I think that having those people who own the disease, who experience the disease, I think if they can come and join the program and have a full leadership and ownership for the program, I think make a lot of difference and bring the program to success. And that often recognized by the government as well. But unfortunately, the funding is something that we need to work it out of how can we continue to mobilize resource in
Okay.
our locality to support them.
I think we need to close because there are next sessions. So maybe if you
Shahid, you want to say something?
Just few words maybe. I think it was, even though our session is really short, but I think we have very good questions and quite a lot of interest in how the lay care provider providing services and the sustainability issue. So I think I would like to thank all the actually participants and for posing the questions, and also all of us, the panelists and Vlada and the union, so giving us this opportunity. So thank you very much, because we need to close. Cameron, to you, if there's anything.
Okay, thank you, Shahid. And once again, thank you to all the audience. Thank you to Shahid, Vlada, Savanri, and all colleagues. Really interactive discussion. I really love this session so much. And I hope that the discussion today will give you some tips of how can we work together to ensure that the model that work for other program can be adopted for TB, especially for HIV, but also at the same time, we have to continue advocate to maintain the role of a community system be integrated into official public health system. So once again, thank everyone, and please have a good day and stay safe together. Thank you so much. Thank you for allowing to be
Thank you. Bye-bye.
Thank you.
Okay,
Bye-bye.
thank you. Bye-bye. Bye-bye. Have a good day.
Bye.